Good morning and welcome to mmlearn.org and our Ask the Geriatrician series. We're so glad you could join us this morning. Today I just want to give you a few overhead thoughts on how to access the information as we're going through the program today, and then I'll introduce our speaker to you. But we want you to know that if you'd like to ask a question while we're showing this live or even later on demand or make a comment, you can do so. If you see the arrow, you can just click on that bubble and make a question, send us one or a comment, and if it's live today, we'll try to get your question answered immediately, and once on demand, we'll get that answer to you within 72 hours. To access any resources that are available, you can always click on the paperclip, and that will be available to you as well. And the most important thing is we want to know what you think, other questions that you have, other programs that you'd like to see. So just make sure that you click on the survey. Probably won't even take you 2 minutes to complete and means so much to us and allows us to continue to bring these programs to you. Today, our program is, what is a geriatrician and do I need one? And such an important topic. I was at a church this week meeting with folks, and this was a major topic of interest. So I'm so glad that we have Dr. Rosa Vizcarra with us from Nick's Senior Care, who is with Nick's Health Senior Solutions, and we are so grateful to them for making this program available and possible for our audience. So I'm going to give a special thanks to them and encourage you, if you have questions, to contact us at info@mmlearn.org, and at the top of the program there's a banner that has their logo, and you can click on it. It will take you directly to their website, and go ahead and click on Senior Solutions and find who you'd like to meet or talk to. So without further ado, Dr. Vizcarra, we're so glad to have you with us this morning, and thank you for joining us.
Good morning. Thank you for having me. So let's go ahead and talk about what is a geriatrician and do I need one? So what is it? Who is it? Who is the geriatrician? We're going to start saying the geriatrician is a physician who has completed a training in either internal medicine or family medicine, and also have gone through an additional 1 to 2 years of a fellowship training, specifically in the fellowship of the medical, social, and psychological issues that concern the older adults. Do you need a geriatrician? If you're getting older and having more health problems, you may want to consider seeing a doctor who specializes in this field, geriatric medicine. Geriatrics, well, this is important. It's a specialty, and it's growingly more and more important as the population ages, and that population actually lives longer. People over the age of 85 are the fastest growing segment of the population. So at this time, it's no longer a rarity for people to live to be 100 or more. Some statistics talk to us and said by the year 2030, when the last of the baby boomers reaches the age of 65, the U.S. population 65 and older will exceed 70 million. This is approximately twice the number in 2000. As Americans 77 million baby boomers age, the need for healthcare professionals trained in geriatrics will be in really high demand. So we talk about geriatrician. We talk that the geriatrician is a doctor who specializes in the care for people 65 and older. And just as the pediatrician tends to the need of the child, a geriatrician cares for the special needs of changing seniors. Geriatricians approach each patient's need very individually. They possess the knowledge and the expertise that are needed to accommodate the seniors. They can better address issues like memory loss, arthritis, osteoporosis, mobility, Alzheimer's disease, among others. Clearly, geriatrics includes more than treating physical problems. It means recognizing how other health conditions can affect seniors socially and emotionally, and vice versa. This type of physician, the geriatrician, the practice exceeds diagnosing a physical problem and treating it. The geriatricians collect a complete information about the patient's lifestyle, the community they lived in, where did they come from, who's their family, what's their support. In one sentence, their entire medical history. Let's touch a little bit on the term of geriatrician. The most appropriate term for a physician who specializes in the care of older adults is geriatrician, not gerontologist. And I just want to touch a little bit on this because I have these questions all the time come along, and it's just semantics. A gerontologist is generally a non-physician, even though some doctors that mainly focus on research of aging can also be considered gerontologists, but that geriatrician is the appropriate term. The geriatricians have developed and expanded their expertise in the aging process, the impact of aging on illnesses patterns, the drug therapy in seniors, the health maintenance, the rehabilitation. An example of this could be, we as geriatricians have these 1 or 2 extra years of the training. We go in deep detail about the physiology of aging. We call it like that. How we're different, how the seniors are different from the 50-year-old, from the 40-year-old, or from the 20-year-old. That is the aging system. And then we put that together on the overall evaluation of the patient. The geriatricians serve and see patients in different roles and different settings. This includes hospital, includes the long-term care, includes home care, and includes terminal care. So any place that there is a senior, the geriatrician can serve and see patients on those settings. These geriatricians are also frequently involved in ethics consultations. They're also part of ethics committees that represent the unique health and the disease patterns seen in seniors. The geriatricians are by definition really team players. They're the ones who really know more than maybe other physicians that they can't just deliver care to seniors just by themselves. They need a team. So the model of care practiced by the geriatricians is heavily focused on working closely with other disciplines, such as nurses, pharmacists, therapists, social workers, and of course, other physicians. Now, let's just go a little bit on how can a geriatrician help. There's so many topics, and some of them could be assessed and counsel about the list of medications. And we will touch base a little bit more on this. Memory loss, difficulty walking, balance issues, pain, urinary incontinence, falls, and chronic illnesses, hypertension, diabetes, arthritis, cholesterol, osteoporosis, mood disorders like depression and anxiety, which could be so different presentations in this population, agitation, especially with memory issues, start having behavioral problems, end-of-life issues or topics, hospice, elder abuse, legal documents, advance directives, living wills, power of attorney. Geriatricians are very keen in family conferences. It's part of the training, including the family members, the social support, the friends. So family conferences are really an area of expertise for geriatricians. They can also help with placement issues, maybe decision capability, even though doctors, geriatricians as doctors, cannot assess competency as a legal term, we can assess the ability of patients making decisions, which is a very valid concern. We can also help with the navigation of the healthcare system, the coordination of care that we have mentioned, And also community resources like adult daycares, senior community centers, memory care centers, etc. So let's move a little bit on some of the examples. Reviewing the medication list. The majority of seniors and patients with 3 or more chronic conditions will take more than 5 medications. This is a fact. So if somebody has high blood pressure, high cholesterol, and diabetes, almost 100% sure that they will take more than 5 medications. Any other 3 more chronic conditions will do the same. As a geriatrician, and for the senior populations, if somebody takes more than 8 medicines, it's already a red flag. This is a red flag for side effects and for multiple interactions. So reviewing a list of medications in geriatrics is one of the big things that we focus on, trying to talk to the patient and the families about what medications they're taking, what are the supplements they're taking, and what are the priorities, and what could be the side effects and the interactions is one of our major challenges nowadays. Memory loss. The memory loss, we assess that. We assess the causes, the treatment. We talk to patients and families about the short and the long-term goals on the treatment based on what is the cause of the memory loss, what could be the cause, what could be the expectations, where most likely things will take from here, and we can help them with and assist them with placement planning, with home care needs, with mood behaviors that are so common on these conditions. Another big syndrome or big problem in geriatrics and senior populations are falls. And the falls are so important. Having a fall within a 6-month period is a red flag, and it's an indication for somebody to be evaluated just on the base of that fall. If somebody has 2 falls in a 6-month period, we know as doctors that even the life expectancy within a year, it could be very affected. The risk of dying from any cause within 1 year is very high. Usually falls are multifactorial. That means there's so many culprits that can be found. Medications interactions, environmental hazards, problems with pain. There's just so many reasons. So these falls need to get assessed specifically. We involve physical therapy, usually, occupational therapy. We work on trying to control their pain, and we talk and discuss about the risk of more falls. We know that once a senior falls, the risk of having another fall, it really doubles. We have talked a lot about care coordination, and really this is one of the big things, among others, that we really work on. We try to work with multiple consultants. It's not unusual that patients will have and see their heart doctor, their lung doctor, their stomach doctor, their bone doctor, their bladder doctor, their brain doctor. So there's so many doctors involved, which is a good thing, but many times they don't know what the other one is doing. So in geriatrics, as primary care physicians for this population, we coordinate these and we try to summarize what are the things that are important. We focus in priorities for the patients. Maybe our priorities as doctors are different, and we try to come along the way with the patients and really meet with them and say, what are the priorities? Let's focus on the priorities. We talk about life expectancies. We talk about what to expect, what if. So this is the way that we practice the geriatric primary care. End-of-life issues. And when we talk about end-of-life issues, we talk about hospice, palliation, terminal illness. I mean, not everybody has to be on hospice. Not everybody should not be on hospice. It's not about everybody. It's about a patient individuality. But we do have the expertise, and we do have the familiarity to talk about these sometimes delicate topics. Again, family conferences are important. Decision-making, placement. What if I was diagnosed with a terminal illness, what do I want? What are my priorities? How can somebody help me to coordinate my care? Where's the family confused about what are their choices? Where should they go to get more information, to make decisions for patient's plan and patient's placement maybe in the future? We do talk about those issues. And it seems like everything was so fast. There's so many things that geriatricians do. I want to thank you for your attendance, and I will be open for questions. Now, I just want to tell you, FYI, like the slide says, geriatric medicine has the highest level of job satisfaction in all subspecialties. And I just want to brag about that, because that means that we geriatricians are pretty much happy people, because we do love what we do. Okay, seems like we have some questions here. And the question is, do I need to have a referral from my primary doctor to see a geriatrician? Okay, this question is generally no. Now, if you do have a primary care doctor that has been assigned dependent of your insurance policy, you may have to. So it really varies between insurances. You should be able to call your insurance and find out on those specific details. Does every hospital have a geriatrician? Not really. There's some hospitals that don't have geriatricians, and I just want to tag a little bit of information with that. Primary care physicians, we geriatricians are primary care physicians, family medicine by training or internal medicine by training with extra training. So they do have a lot of doctors who sees all their adults, but not everybody has geriatricians. So you have to look for that. My mother is 95. I can't get to an office. Do geriatricians make house calls? Yes, many do. I live in Montana, and I don't think we have many geriatricians. What would you suggest I do? There's several resources, American Geriatrics. You can look at your state board website for geriatricians. I'm not very familiar in Montana, but I'm pretty sure you will be able to find some maybe in other cities. There is a shortage of geriatricians among the nation, but there's mostly geriatricians, especially in some of the larger cities. Do geriatricians visit nursing homes, or are they regular doctors? Both. Geriatricians, we usually go to nursing homes. We see patients in any setting, but also other doctors, specialists, do go to nursing homes, especially family medicine doctors and internal medicine doctors. How long does a geriatrician go to school for this training? Okay, like I explained before, we do have an initial training in either family medicine or internal medicine, and that is 3 years. And then we go extra training for 1 to 2 years, specifically in geriatric medicine. So you can add that up, and it's either 4 to 5 years after medical school. I am worried my father is on too many medications. How can I tell the doctor without sounding like I am the doctor? This is a very good question. You know, just be honest. Take a list when you go to the doctor. You know, you take your parent with the doctor and just write the list. And just say to your doctor, I really would like to know, you know, what are the indications for every single medication. And we do that all the time. You know, this is for blood pressure, this is for blood pressure, this is for memory, this is for the pain, this is for the bones. That way, you know, you can do that. Now you have to focus on priorities, like we said. And many times we doctors, if we get reminded, we are able to cut down on medications. How can I convince my mom to see a geriatrician? She says they are just for old people. I know, I get this all the time. Just, you know, I don't know what to tell you. Just tell her that we're not just for old people. We're actually for young people. We just want to grow with them as they age. And we are primary care physicians by training with internal medicine doctors or family medicine doctors. So maybe just getting more information about what we do and why it's important. And it doesn't mean that she's old, that she needs a geriatrician. That will be a way, you know, a good way to put it. Next questions. How do I find a geriatrician? Okay, you find a geriatrician pretty much by looking up on your medical resources wherever you lived in. We usually have announcement that says that we are board certified in either family medicine and or internal medicine, and we are board certified in geriatric medicine. That will be your best bet. Again, every state has their medical board where you can find the information and just type up, the geriatrician or geriatric medicine doctor, and I'm pretty sure you can find the names of the local geriatricians. I need help with my family to convince them that my father is unable to make decisions for himself any longer. Should we see a lawyer, a general doctor, a geriatrician, or a psychiatrist? And you probably know my answer to that. The geriatrician will be a very good start. It really can help you to coordinate all that and help you with the next step. The next question is all dementia Alzheimer's? No. Alzheimer's is one kind of dementia. Dementia means memory loss plus some other cognitive deficits. So Alzheimer's is one kind of dementia. So not all of them Alzheimer's. Right now, yes, the majority of dementias could be due to Alzheimer's, especially in elder population. But they're not all Alzheimer's. Will a geriatrician take the place of all my other doctors? No, we do not take the place of all the other doctors. We coordinate the care, we facilitate. If the patient needs to be seen, the heart doctor, because had a history of heart attacks, had stents placed, had surgery in the past, bypass, pacemakers, they will need to see the heart doctor. It's just that we coordinate the care and we'll be kind of like the home model for that patient, where the information can come and we can coordinate. They don't have to be seeing their heart doctors if they're stable every month or every 2 weeks. But they will continue to see their other regular doctors if there is a need. Would you, as a geriatrician, when it is time to put my mother in an assisted living facility? Yes, this question is related to if we as a geriatrician can recommend when it's time to place someone in an assisted living facility. And yes, we coordinate based on the patient evaluation, needs, resources, what will be the best next step for the care on the patient. And thank you so much for joining us today. Seems like we don't have more questions.